Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Carolyn Bonquin, sitting in for Pinky Webb today on the program. The Interagency Task Force places 28 more areas under Alert Level 3 in a bid to curb the spread of COVID-19. The Health Department sets a policy shift from contact tracing to testing for clinical management as cases continue to rise. And health workers groups oppose the government's decision to shorten the isolation and quarantine period for health workers who get exposed or test positive for COVID-19. Health Secretary Francisco Duque III joins us live. Both the World Health Organization and the Health Department are saying it is premature to tell if COVID-19 cases have peaked in the Philippines. WHO Country Representative Dr. Rabindra Abeyasinghe explains we will continue to see cases increasing as the virus spreads out to other regions. Meantime, the DOH is starting to see COVID-19 cases spikes in Calabarzon, Central Luzon, Ilocos Region, and Cagayan Valley. Let's go straight to the source of the story, Health Secretary Francisco Duque. Sir, good morning po. Welcome to the program. Sir, 28 more areas under Alert Level 3 until January 31. What does this mean, sir? Does it mean that the surges or there's also a surge happening in other regions, not just in Metro Manila and the nearby areas?
Yes, that is correct. Based on our metrics of 2-week growth rate and our ADAR or average daily attack rate per 100,000 population show that they have been escalated to Alert Level 3 precisely because of the speed of the spread and also because of the increased risk for more and more communities affected with COVID-19. And so they are now considered at high risk classification. And this is equivalent to escalating them to Alert Level 3.
Okay. And then, sir, which particular regions are you most concerned po regarding the spread of the variant?
Of course, NCR is the major region, the epicenter of this wave or surge. And then you have regions 4A or Calabarzon, Region 3, Central Luzon, and then Region 1, Ilocos Region, and Cordillera Administrative Region. And also, I think even Region 6 is showing a continuing increase in the cases.
Sir, kasi dun sa Metro Manila, based on the DOH recent analytics or analysis, yung pong case trends kasi is parang pael, ang sabi ni Undersecretary Vergeire, which is a characteristic of the Omicron variant. Are you also seeing the same pattern in other regions, sir?
Well, I think it's going to follow the same pattern eventually, but we are again guided by our metrics, and the trend seems to be similar for regions outside of NCR. So the L-shaped epidemic curve is likely to be observed in the other regions as well.
And sir, the Philippines is currently under critical risk. Sir, can you explain it briefly? What are the indicators of being under the critical risk classification, and what does this mean for us?
Well, it's under critical risk classification, as I have earlier said. This warranted the escalation of the alert level from 2 to 3, no? And that means that under alert level 3, there will be restrictions in terms of capacities for business establishments. No, like an example would be restaurants, where for alert level 3 we have 30% capacity that is allowable, and that is indoor. While for outdoor, you are allowed 50%. But for both capacities, they can be expanded based on the following additional conditionalities. Number one, if the vaccination rate for A2 and A3, meaning the senior citizens and individuals with comorbidities, reaches greater than 70% vaccination coverage, then you're allowed to expand 20%. Second conditionality is if the establishment has been granted or awarded the safety seal, you are also likewise allowed another 10%. So that's in total 60% pa rin. So malaki-laki pa rin, substantial pa rin. Whereas outdoor, which is 50%, so plus 30% ka once you get the vaccination coverage greater than 70, safety seal 10%, the other one 20%. So that's about 80%, no? So it's still substantial. So I appeal to all these business establishments to make sure that they follow all of these guidelines.
And then, Secretary, Metro Manila mayors want to stay under Alert Level 3 beyond January 15. So what's the IATF recommendation po on the region's alert level, and what does the DOH metric say po?
Well, right now, we are at alert level 3, and we are again guided by a third metric, which is the healthcare utilization rate. No? And right now, the healthcare utilization rate is at, I would say, about 55, 56% for NCR, ICU, and the isolation bed utilization rates. And they're well within the moderate risk classification. So unless this one breaches your 70% utilization rate, both for total beds and ICU, we will recommend to keep the status quo.
Okay. So sir, just to clarify, based on the DOH analysis po, yung epidemiology department nyo, it seems like Metro Manila is still under alert level 3 based on the metrics.
Exactly.
All right. And then, sir, next question po, travel ban. Are we going to continue to implement this, and are we going to add more countries?
Well, this will be a subject of our IATF discussion this afternoon, precisely because since based on the recent runs of our genomic sequencing, we already see more and more of Omicron cases, no? And also, there are more than 150 countries now, I believe, that have been affected by the Omicron variant. So we will see if it is still practical to still implement our travel ban. So as a matter of policy, this will have to be resolved later on by the IATF and bank.
And then, Secretary, over 32,000 new cases reported on Wednesday. Sir, what is the DOH projection? Are we going to still see a continued spike in cases? When will this peak po?
Well, we don't know if the plateauing has begun, because the other day it was, I think, about 33,000. It went down a bit to 28,000. Yesterday it went up to 32,000. So this afternoon and perhaps the remaining days of the week will give us a better inkling of whether a plateau is starting to develop, or hopefully it's going to go down. No, I mean, we're all hopeful that the cases, the number of cases will go down sooner rather than later. But it's premature to say anything at this point. So what we know is these are the number of cases that we've had over the last 3 or 4 days. So parang nagpa-plateau, no?
And then sir, does the DOH recognizes po na possibly mas konti o mas marami pa kaysa dun sa 32,000 yung actual cases because there are also other people who are just staying at home or maybe not getting tested or just taking the antigen test?
Ah, yes. You assume that. From the very start, you assume that. All countries assume that. That the testing numbers, the positive results are actually lower as registered with the Epidemiology Bureau. But remember, we're not testing everyone, okay? So you just assume that the numbers that we see now are just indicative numbers. It just establishes whether we are in an upswing or uptick or acceleration phase of the surge, or are we plateauing, or are we in a crescent or a downward trajectory. So these are just indicative numbers.
All right. We still have more questions to you, Secretary Duque, especially about contact tracing and testing, but we'll be taking a short break for now. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. I'm Carolyn Bonquin. Our guest today, Health Secretary Francisco Duque. Sir, again, sir, tutuloy lang po natin yung discussion natin about contact tracing and testing. So, the government is actually changing its strategy in contact tracing and testing in areas with community transmission. Sir, could you please explain lang po kung ano yung ibig sabihin itong in-explain nga rin po ni Undersecretary Vergere na contact tracing is not much a priority in areas with community transmission, also for the testing na this is only primarily for clinical management of patients. Okay. Sir, okay. Sir, Secretary Duque, I think you're on mute po.
Oh, yes. I'm sorry. Yeah, I said I will underscore the points raised by you, Sec. Vergere. When it comes to contact tracing and testing. For the contact tracing, when there is widespread community transmission and it is sustained, it is impractical to do contact tracing. You'll be wasting a lot of resources doing contact tracing when you know that the cases are already on an upswing. They're accelerating. More and more communities are being infected. And so the better and more practical thing to do with impact is to use the contact tracers for other high impact activities. Like, for example, monitoring of people who are in home or isolation quarantine. No? That's very important. Meron naman telepono, they'll find out how the person is. Then they can do symptom monitoring of those in home or isolation or quarantine. They can also be used to help in the vaccination activities and several others in health promotion. So there are many more activities, high impact, meaningful activities rather than doing contact tracing when you know it's now very difficult to contact trace everyone. You assume the infection rate is quite high because Omicron is known and pretty much established that it is highly transmissible, more than Delta and other variants. No? Now, for testing, the same is true because of limited testing and also because some of our laboratory technicians are either in isolation or quarantine. So the testing output or capacity is reduced because of these circumstances. And therefore, the shift of policy is towards prioritizing testing of a A1, A2, and A3 groups, okay, within the priority framework. So, which means A1, all healthcare workers, they need to be tested regularly. And then, of course, the A2, the senior citizens and individuals with comorbidities. We prioritize, given the limitations of our testing capacity at the moment, we will prioritize those who will benefit from the testing, because once positive, then that result will guide the physicians in managing these people, and can also be benefited from the new antiviral medicines, investigational drugs, such as, you know, the remdesivir, the tocilizumab, the now we have the Paxlovid, the molnupiravir, no? So that's the rationale now for a shift in the policy vis-a-vis testing and contact tracing.
So, sir, given that, Secretary, given that, what will the contact tracers do now?
Yeah, as I've said, there will be much better put to more impactful activities like monitoring of individuals or families who are in home isolation or quarantine. They can help in symptom monitoring of those individuals in isolation or quarantine, and also for augmenting human resource within vaccination centers, and also help in information, education, and communications campaign for better compliance to minimum public health standards. You know, Carol, what is really important here are two things. No? One is the continuing vaccination, and I appeal to all LGUs where there is now an increasing number of COVID-19 cases, and we assume they're Omicron variants, and that's why they're going to be very quick, very speedy in terms of spread. And so the one of the way to counter this is to ramp up vaccination. Of course, you begin with vaccinating again the elderly individuals, because they're the ones who eventually land in ICUs, in hospital facility and other facilities. Okay, so they need to ramp up their vaccination, followed by, of course, the unvaccinated. They need to already begin vaccinating people who have not yet been vaccinated, and after that, they can do also booster doses. They can start and do parallel booster dosing of individuals who have already completed their inoculation. So that's very important. So I also want to take the opportunity to underscore for the general public, once symptoms are present, they should isolate. You know, the thing there's isolate. Huwag ka na mag-antay mag-test pa. If you're symptomatic, you isolate. If you are exposed to a person that tested positive, you also isolate. You don't wait for the test results to come out. Okay, that's not the right thing to do. That is isolate right away. So vaccinate. Okay, isolate. Okay, for people. Now the MPHS is very important. There are two things, no, in our overall response: vaccination and compliance to minimum public health standards. So masking, okay, social distancing, proper hand hygiene, proper hand washing, use of disinfectants, especially on high touch areas or surfaces, and of course, avoidance of the poorly ventilated places, crowded places, close spaces or crowded areas, and also close contact settings. We need to avoid all of these to contain and to reduce the number of infection.
Secretary, studies in the US shows that about 40% of Omicron cases are asymptomatic. So won't this new guidance on contact tracing and testing affect our efforts to stop the spread or curb the spread of the virus?
No, precisely why we emphasize the importance of minimum public health standards. We are aware 40% of Omicron variant cases from due to Omicron variant are asymptomatic. No? So that is why it's very important that bearing that in mind, it is more compelling that we always wear our mask. Kasi lalabas ka, di ba? Because you're asymptomatic. Okay? So you go out. You don't feel anything. So the important thing is for you to wear masks so that you prevent spread from yourself to those close to you and vice versa. You also prevent others from infecting you. So this is really key. Not just vaccination, but masking, mask, hugas, iwas, ventilation.
In a tweet, Governor Cheese Escudero slams this change in policy, Secretary. He says na wala na ngang libreng mass testing, babawasan pa yung testing. What DOH is doing is not a COVID-19 response strategy, but a complete abdication and surrender. It's an if you can't beat them, join them strategy. Your reaction to this, Secretary?
Hindi naman. I don't think that has any basis. Remember, we have been through 3 or 4 surges, okay, in the past. We had March, April of 2020. Then we had July, August of 2020. Then we had March, April of 2021. Then we had the latest Delta surge prior to the surge today. That was August, September. And we always did the same. Very good compliance with minimum public health standards, mask, hugas, iwas. And then late last year, mid to late last year, we ramped up our vaccination coverage as soon as supplies stabilized. No? So that's why you will see now the severe and critical cases are much lower compared to prior to our vaccinating majority of our people. And supporting that, again, is the continuing adherence to minimum public health standards, which have helped us bring down those surges 3 times and now 4 times. Hopefully, this one will also go down. I'm confident that this thing is going to go down as well. So it's what I say the smart thing to do. It's not going to cost government that much given the limitations of funding. Siyempre, tandaan natin ang tax revenue generation that's also affected by this pandemic. So we just have to make sure that the limited or scarce resources that are available are put to the best use and the greatest impact.
And then how about the cost of testing now that we are experiencing a surge? Kasi ang dami pong nagrereklamo, Secretary, na ang mahal-mahal daw ng RT-PCR test sa bansa. Hindi po ba ito kayang pababain pa para mas maging affordable pa yung presyo?
Yeah, we will look into this. We have in fact already implemented a lower testing fee, no, for both cartridge and plate-based RT-PCR testing. It's now, I think, for public, it's about 2.8 thereabouts for plate-based RT-PCR, and for cartridge-based, it's about 2.4 thereabouts. And for the private, it's a bit higher because they have to shoulder all the testing inputs, the test kits, the human resource, the overhead cost, etc. But we will still see if this can all be brought down further so that this will unburden our people of the what they say is a costly testing.
All right. We'll be taking a short break. This is a source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. I'm Carolyn Bonquin. Our guest today, Health Secretary Francisco Duque. Sir, thank you again for joining us. Sir, regarding the home antigen test, self-administered test kits, what's the update on the FDA review on the application? I believe 2 companies already submitted an application for CPR.
Yes, that is correct. The FDA, upon my instruction, has already notified all these test kit manufacturing companies and distributors to already apply for the self-administered test kits so that people will have better access to the testing. But let me just underscore the importance of what I have said earlier. If you have the symptoms or if you have been exposed to a confirmed case, you just undergo, if with symptoms mild or asymptomatic, you undergo a 5-day quarantine. Okay, this is for the general public. But if 7 days, I think that's for. Let me just double check. Okay, for the isolation period, those with probable case with symptoms or mild, if they're fully vaccinated, they will have to be isolated for 7 days. I'm sorry, it's not 5, it's 7 days. Okay, for the partially vaccinated or unvaccinated, it will be for 10 days. Now, for the asymptomatic cases, if you're fully vaccinated, you will be undergoing isolation for 7 days from the test results that comes out, from the day the result comes out. Okay, so for partially vaccinated or unvaccinated, you will have to be isolated for 10 days from the time you get a positive test result. And for moderate cases, the isolation is for 10 days from the onset of symptoms. So we have a new guidelines, and this will be published as soon as it is signed today for implementation.
Health Secretary Francisco Duque, thank you again for your time.
Okay, thank you very much, Carol.
And thank you for joining us here on The Source. I'm Carolyn Bonquin, sitting in for Pinky Webb. You're watching CNN Philippines.